guys, Jess Olin from Integrated Functional Wellness coming at you with the tip of the day, how to release your hip pain. A lot of clients be coming to me with different issues with back, hip, psoas pain, and it's all interrelated with that fascia and that connective tissue. So a really simple tool you can use at home is a tennis ball. Very inexpensive, very budget friendly, and very accessible to everyone. I'm going to show you how to release my right glute complex or my left hip complex. You're going to use your body weight as leverage to help release these 3 points that I showed you, okay? You're going to put this tennis ball more towards that piriformis, a little bit lower, okay? Towards that glute, and you're going to sit on it in this 90-90 position, or a figure 4 position we call it, okay? And again, once again, you're trying to shift your body weight onto it to add a little bit of leverage to kind of give you that nice release in that area. And I just want you to sit on it and breathe, okay? It's really important to use that diaphragmatic breath, that big inhale, exhale, and relax into it. The most important thing is to tap into that parasympathetic nervous system, that rest and digest mode, not that fight or flight. So don't have your shoulders going in your ears. And if you feel like you're tense, like come down on your forearms or even lie down, okay? Wherever you feel like it's the most comfortable position for you, okay? Once you're nice and comfortable, and on that pain scale, from a scale of 1 to 10, you're about maybe a 4 or 5, then you offer mobility or distraction or movement, we call it, okay? You're gonna offer this clamshell movement, which is just open and close, okay? Exhale, inhale to close or to open it. And then we're gonna do this nice pin and stretch move, kind of like this bicycle pedal that I call it, like you're pushing this big bicycle pedal out. Do that a couple times in each direction. And you want to brace your core a little bit so you're really tapping in that diaphragmatic breath. You can marry those two movements, which is the clamshell, the bend and stretch, or the pin and stretch, clamshell, pin and stretch. We're going to move to that second point, which is your greater trochanter, which is a little bit more lateral on that glute. And you know you're on it when you start to do this internal, external, or this clamshell, and you feel like this kind of like electricity going up your body, like, ooh, that's a good point. You're going to hold that point. You're just going to breathe here, okay? Once again, using that inhale, exhale, keeping your upper body nice and relaxed. And once you feel like that on that pain scale, you're down to that 4 or 5 on that scale, and you're nice and relaxed. Do that nice clamshell a couple times, and offer that pin and stretch as well too. So we're just offering distraction, pliability, you know, really moving the tissue and that fluid around. And then from here, that third point is more near to the SI area, or SI joint area. This area is a little bit more towards that tailbone, so you're going to roll that foam roller or the tennis ball more towards the tailbone, and you're just going to rock it north and south, east to west, nothing too crazy. And once again, if this hurts your wrist, come down onto your forearms, okay? Or even lie down completely flat on your back, whichever is nicer for you, okay? And if it's nice and comfortable here, stay here, and you're gonna offer that nice little bicycle pedal, okay? Knee to chest, push it out, even do that nice external rotation, push it out that way, and just think about different movements of the leg going out, okay? From there, after you've done that area, rolled out that area or hit that area, I want you to stretch right away, because once again, that offers more extensibility or pliability to that tissue. So best stretch is that pigeon stretch or figure 4 that we call in yoga. So come into this nice figure 4 stretch, or this 90-90 stretch, and nice and easy, walk your fingertips down to the floor, to your range. You're not hunching, but you're nice and lifted through the breastbone or the chest, and just breathe into that glute and that hip. And then work your body or work your movements to go around in different areas, working clockwise or counterclockwise as you reach and stretch. Maybe you reach the opposite lat this way, that way. Just move with different movements to open up that fascia and that tissue line, or the fascial line we call it, okay? You can do that on the opposite side as well, okay? So once again, that 90-90 or pigeon stretch, and you're coming down, go to where you can keep your breastbone up if you're on your forearms or even on your hands. You don't have to clap all the way down if you don't have that flexibility in your back. This opens up your QL, it opens up your hip complex, it opens up your lats as well too. And once again, play with range. So maybe you're reaching this way, you're reaching the opposite lat this way, and you're opening up that hip complex completely in different planes of motion, okay? I hope you enjoyed my video. Please subscribe if you like me. Have